Pues bueno, yo en realidad vengo a defender el smile porque
I'm going
soy
to
muy
advocate
de
for
smile.
smile. I
Tengo el
really like
FemtoLASIK
smile.
también,
I
tengo
have
el smile, tengo puedo hacer las
FemtoLASIK, I
dos
have
cosas
smile, I can do both
y os quiero
things.
explicar
And I
por
want to
qué
explain to you
realmente
why really
yo me decanto siempre
I
por el smile.
always prefer the
Y no quiero
smile.
problemas, quiero tener a
I
los
do
pacientes
not want
contentos y buenos
troubles, I
resultados,
want
¿no?
happy patients and
Creo
good
esto es lo más
results.
importante, ¿no? Que solo
Now,
el
this is what
conocimiento
matters
convierta la
most.
opinión en
Just
criterio,
knowledge
porque se puede
makes
oír muchas cosas del
turns
smile, pero
opinion
casi
into a
siempre se oye gente que
criterion.
no lo
You may
maneja, que
see
no lo usa,
say many good things about
que no
smile,
pasa
but
la curva de
people have
aprendizaje.
not had their learning
Entonces, bueno,
curve
simplemente os quiero contar
and don't use
que
it.
para
I
mí,
would like to
bueno,
tell you
cuando
that
empecé con el
when
smile,
I started with
el comienzo
smile,
fue duro, tenía
the
pocas
beginning was
referencias, fue
hard.
por
I have
2013,
few
2014.
references. It was 2013,
Lo
2014.
pasé mal,
I had
aunque a
kind
mí
of a
me
bad
ayudó mucho
time,
Zeiss
although
con sus
thighs
aplicadores,
with the
pero realmente
applicators helped me
yo
a
tenía
lot.
experiencia quirúrgica en
I
refractiva
had surgical
y
experience in
aprendí prácticamente solo y al
refractive
principio lo pasaba
surgery. I
mal
learned by
porque
myself, and
tanto que
I
dejé de
didn't
hacer
have
unos meses y me
did
volví al FemtoLASIK
a good
porque yo
time at the
decía,
beginning, and I had to go back to
opero a un
FemtoLASIK
paciente
because I operated on a
y
patient.
al día siguiente ve
And the next
0,3.
day
Entonces
he
yo
saw
le hago un flap
0.3,
y al día
and
siguiente está
I
viendo
made a
igual. Pues
flap,
es
and then the
mucho
following
mejor
day it was
que
1.
me vuelva al FemtoLASIK
And so I
y
thought
dándole
it's better
vueltas
for
yo
me to go
decía,
back to
joder, no, pero esto hay que intentarlo,
FemtoLASIK.
seguro que no es
But
la tiroides, sino que son mis manos.
turned the idea around in
Entonces,
my head and
pues
said,
poco a poco, como
possibly
digo yo,
it's not
que el éxito siempre va a ser talento
not
más
my hands.
esfuerzo,
So
constancia,
success is
disciplina.
talent plus
Poco a poco fui
constancy,
imponiéndome a mí mismo
discipline,
ir mejorando la
and
técnica
hard work. And so I
y lo que al
imposed
principio
upon
era
myself
picar en una
to
mina, pues acabó
practice the technique better.
en algo que
And what
empecé a
was a small
disfrutarlo y a
thing at the
tener unos
beginning,
resultados
it was something
que
that I
distan
started to
mucho de los que
enjoy
tenía al
and
principio,
getting
sobre todo a corto
outcomes
plazo.
which
En los
were
primeros
far
pacientes
better
lo
than
que
at the
ocurría es que
beginning,
al día
especially in the
siguiente no
short
veían
term.
bien, pero luego
Patients
en
the
una
following day
semana
couldn't see well,
hay
but then
varias
in a
publicaciones
week,
que hablan de que el
there are
smile
publications that
tiene
say that smile,
el día
the
siguiente
smile,
peor
the
visión que el
following
FemtoLASIK y
day,
eso es
people have worse vision
rotundamente
than with
mentira.
FemtoLaser, but that's
Lo que pasa
bluntly
que
a
las
lie.
manos son a
It's a
veces un
blunt
poco
lie, but the
brutas,
hands are a
pero
bit
no
rough
son
at
las manos,
times. But it's not the
no es la
hands.
técnica, son
It's
las
not,
manos que
sorry,
hace
it's
ese
not the
smile.
technique, it's the speaker,
Entonces,
it's the hands and the
nosotros
smile.
no cobramos en nuestro
So
centro,
we
no
do
cobramos más
not,
por
in
un
our
smile que por
center,
un
we do not
FemtoLASIK.
charge more for the
Tengo
smile
el
than for
VisuMaps que puedo
FemtoLASIK. I have the
hacer un
VisuMaps.
flap, tengo
I
el nail,
can make
que
a
puedo
flap, the mail.
aplicarle el
I
steamer
can
y yo no
apply
quiero
the
problemas, quiero que
eczema.
los pacientes
And I do
tengan
not
tratamiento, estén
want
contentos.
problems.
Con
I
lo cual,
want patients
si hago
coming
smile es
through
por
my door
algo,
to be
¿no?
happy. If I do smile,
Hace
it's
ya más de
for a
8 años que
reason.
no hago un flap en ningún
Over
miope.
8 years, I haven't made a flap
Generalmente
in
me
any
muevo o en
myopic
PR Kappa graduaciones
person,
bajas o
and
voy a
PR
Smile a
Kappa,
cosas del Smile, que es una
different
cirugía, como sabemos,
gradations,
mínimamente
but the
invasiva,
smile is
que
minimally
preserva la
invasive
integridad de las
surgery,
capas superiores de
preserving
la
the
córnea,
integrity of the
hay menos
upper layers
corte
of the
de
cornea.
terminaciones
There's less
nerviosas, da
cut
menos
of
sensación,
nerve
síndrome de
endings,
Joseco y minimiza el riesgo
Joseco's
de complicaciones
syndrome
que podemos
less
tener con el flap, ¿no? Por una
important, and so
recuperación del epitelio muy
the
rápida,
recovery
no
of the
solo hice una
epithelium is
pequeña
very
incisión
fast
de
because it's just a
2,4
small incision of
milímetros.
2.4
El corte con el
millimeters.
láser de femtosegundo
The
del
cut
lenticular
with the femtosecond
transfiere a la córnea
LASIK
directamente la
transferred
forma
to
del
the cornea
lentículo
the
diseñado
form or the
teóricamente,
shape of the
¿vale?
lenticulus
Entonces
designed
es un
theoretically.
lentículo que
So it's
está
a lenticulus
muy bien
which
determinada
is
su
very
forma, gran
well, has a very
predictibilidad.
well determined
Yo
shape,
llevo
great
más de
predictivity.
1.500 ojos
I
tratados
have
por mí
treated
con
over
Smile y
1,500
solo he
eyes
tenido que
with the
retocar 3
smile, and I've
ojos.
just had to
Creo
retouch
que hay una
3
gran
eyes. So there's a
reproducibilidad, una gran
great
predictibilidad en los
reproducibility
tratamientos que hacemos.
in the
Y
treatments
bueno,
that we
es
deliver.
un láser que
And
cuando
so
lo
it's a
manejas te da
laser that when
mucha
you're able to wield it
seguridad.
well, you feel
No se
really
requiere
confident and
calibración como
safe.
un láser,
It does
no
not
hay que
require
hacer
calibration
test de
like
fluencia,
laser. You don't
no
need fluency
incluye las
tests.
condiciones del quirófano, la
The
temperatura,
OR
lo que
conditions,
sale del aire, tanto como en
temperature,
un
whatever is in
excimer.
the air, so much as with an
La
excimer
zona óptica está
laser.
totalmente
The
corregida
optical
desde el
zone is
centro
totally
a la
corrected from the
periferia
center to the
y
periphery,
los mapas
and the
topográficos
topographic
postoperatorios confirman esa forma
post-topographic map
prolata
confirm
de
that
la zona óptica
prolate shape of the
que luego
optical
vamos a ver
zone,
la
which we'll
calidad
see
visual que tienen estos
what
pacientes, ¿no?
visual quality
Entonces,
these
los usuarios,
patients
como está
have. So
publicado,
users,
reportan
as has
menos
been
aberraciones
published,
postoperatorias que
they
con
have
LASIK,
less
especialmente en
aberrations
aberraciones
with smile than
esféricas.
with laser, especially
Ya hemos
aspherical
dicho que
aberrations.
es un láser que no hay que
It's a
andar moviendo al
laser.
paciente
You
de una
don't have
varilla a
to
otra,
move
crea un
from
lentículo
one bed to another.
refractivo
The patient,
y la
it
incisión en un
creates a
solo
refractive
paso con el
lenticulus
láser
and
en
incision in a
unos
single step
24
with a
25
laser
segundos,
in
¿no?
24-25
Las
seconds.
tolerancias necesarias cuando hay
The
varios láseres
necessary
involucrados ya
tolerances
no
when
son
there are several
necesarias.
lasers involved are not
Planificación
necessary
del tratamiento
anymore.
de entrada de
Planning of
datos en un
treatment,
único
entry of
láser, que
data
esto
with a
lleva
single
ahorro de tiempo
laser, that saves
y
time time. And as we said, we don't have to move patients from a stretcher from a bed or a table to another. And so like with the eczema. Three differences vis-à-vis LASIK: removal of tissue, more accurate and reproducible. The precision of laser is not affected by environmental factors. Different nomograms are not necessary. Less cut of corneal nerves, so less dry eye, and better in preservation of biomechanical integration. Randleman et al. Published a study in 2008 measuring the strength of the stromal leaves depending on where they were. Based on those results, Reinstein elaborated a theoretical model that allows to calculate the post-op corneal strength and compare PRK, LASIK, and SMILE. And at the end, removing the same microns with the SMILE, you affect less the corneal strength, and so biomechanically is the best technique. There are several papers which bear witness to that. I think the corneal biomechanic strength SMILE was superior to LASIK. Another paper telling us that it has been proven that in visual acuity and dry eye contrast, the SMILE is superior than LASIK. This study that I showed, which was a randomized study conducted in 2014, the conclusion of it was that both in visual acuity, SMILE, a mild improvement was better in SMILE than LASIK. Contrast as well, sensitivity to contrast. The first days it could be worse with SMILE because of the bad scattering that takes place and inflammation in the lenticulus, but then 3 months later, the sensitivity to contrast is much better with SMILE than with the LASIK and dry eye. We know that with a smaller incision, less cut, and there's less feeling of dry eye and high-order aberrations. There's a lesser index of HOAs in the SMILE group than LASIK group. And I brought this emoji because in this study comparing FemtoLASIK with SMILE, the authors say that the FemtoLASIK is still the gold standard due to the rapid recovery. And I've seen several papers saying that visual acuity can be recovered more slowly. I don't agree. This is a patient I operated on last week. This is an 8-day-ago surgery. It's a female patient, -4 myopic, -2 in the other eye. You'll see we are kind of cutting the lower lenticulus apart. I won't go much beyond my time, I promise. This is the superior part, and let's see how the incision is made here. I make it of 2.4 millimeters, and once they're done, we are going to take out the lenticulus. This is one of my surgeries of 8 days ago. I dissect first the upper lenticulus part. I do not like to use a clamp. Some surgeons take with a clamp of the conjunctiva because it's a bit discomforting. So when you learn how to do SMILE, you don't dissect first the lower part of the lenticulus because it's more bothering than the upper one, and it's hard than if you dissected the lower one before. So the upper lenticulus part has been dissected already, and what we do now, you look for the lower plane, and you can see that it's dissected already, and I put the tool and you dissect, and then as you can see, it's dissected easily, faster, and the lenticulus will get out. Go out fast. I would like to dispel the idea with the SMILE has low recovery of the visual acuity. You see the lenticulus as a whole thing there. This patient operated on the 30th of October, -4 and -2. On the 31st, a colleague of mine saw her, and in binocular was 1.5, and then they saw her again because she had some discomfort, and and we have everything well regulated with the optometrists, according to the Spanish Society of Optometry, with visions of 1.8 after a week here. And I wanted to brought this. Yesterday I operated on a patient, because with a smile sometimes we speak of cylinders. This is a patient that I operated yesterday at 9, at 1 in the afternoon, and my optometrist, together with another ophthalmologist, have seen this patient, and then I said, I won't by WhatsApp what the visual acuity is, because I operated on her at 1 in the afternoon, and today in the morning it was 1.4, so 2 letters in binocular were missing, but look, such high cylinder with a smile. She had a very good cornea, so that's idea. Those things that they tend to say with the smile, the vision is recovered more slowly. Well, it happened to me at the beginning. It's the learning curve. It would be harder for some, less hard for some others. It's much easier to do FemtoLASIK. But once you are able to manage that and you have these results, do not make a flap because it can move. Then after a few years, you see the edge spotted and it died. It's kind of it's like a dye. So the smile is a significant evolution in refractive surgery, less infective and without flap, taking better structural preservation and better and less dry eye visual results, which are excellent and stable. So let me encourage you to kind of come to this field, because it's much better than FemtoLASIK, which I manage well and it's within my reach. Thank you very much. I think that this year in FACO Elche, perhaps we do Smile live, because I've been told to tell you.